Is the vertical mouse the secret to all your wrist pain problems? No, it's not. But ergonomic equipment is typically one of the first changes that many consider when they have a little bit of wrist or hand pain with repetitive use, whether it be from desk work or gaming. So then, why is it recommended? And can the vertical mouse at least help a little bit with wrist pain or discomfort? In this video, I'm going to explain why exercises are actually more important and what role ergonomics, like a vertical mouse, really plays with most wrist and hand issues. I'm Dr. Matthew Hwu, a physical therapist who has been working with the Olympians of desk work, esports athletes, for the past 8 years and have helped more than 2,500 individuals resolve their wrist pain associated with excessive keyboard and mouse use. And in 99% of the individuals that we've helped who tried a vertical mouse, it did nothing to provide a long-term relief. And we'll get to that in a little bit, but did you know that in gaming and esports, players perform 10 to 15 movements per second, up to 500 to 800 actions per minute, and regularly practice their esports related skills for between 5 to 10 hours a day. This is nearly triple the 8,000 to 11,000 keystrokes, which comes out to 130 to 180 APMs, of office workers who are already at increased risk of upper extremity pain, whether it be at the shoulder, neck, back, wrists, or hands. Understanding the amount of stress that's being applied to our tissues is important. Why? Because our tissues can only handle so much. We are repeatedly utilizing the muscles at our wrist and hand with clicking or typing over a typical 8-hour workday. And while it may not seem like a lot of stress for our tissues, it can really add up, especially if this occurs over many years with lower levels of physical inactivity or exercise only focus on strength rather than endurance of the forearm muscles. And this is pretty typical of many tech workers nowadays. The best way to understand this is through the concept of demand versus capacity, or the scale of physical stress, or if you followed our content, the health bar framework. And this is based on what we know with our current understanding of tissue's adaptation to stress, or also known as a general adaptation syndrome. So I want you to think of a scale with the left side being how much stress your tissues can handle, represented by muscular endurance, and on the other side of the scale, the right side, how much stress you're applying to it based on what you're doing on a regular basis. And we start our day out with our weight or capacity on the left side, and let's use an example of 100 pounds. As we work, we're gradually adding physical stress. Intense 2-hour workday sprint, add 30 pounds. Responding to emails and browsing the web for 30 minutes, add 5 pounds. Programming for the rest of the day with no breaks, add 50 pounds. There's no problem if we do this every day and if we always have the capacity of 100 pounds on the left side. But what happens if we do this for several years without physical activity or exercise? 100 becomes 85, then 80, then 70, then a lot less. Or we happen to have a few days where the work sprint is a lot longer and it's a few 10-hour days in a row. The right side then becomes too heavy and our tissues become irritated. Now, where does an ergonomic mouse or keyboard come in? Having a vertical mouse will reduce the amount of weight that you're applying on the stress side or right side per unit time. So think adding 1 pound at a time versus 4 pounds at a time. The scale will tip over more slowly and may not exceed the left side. And remember that number on the left side or your capacity is not static. It changes based on what you've done in the past quarter in terms of physical activity or conditioning. And again, the left side of the scale can drop in weight. And in many cases for tech workers and desk workers, our conditioning gradually reduces as we have a really sedentary lifestyle. We sit for many hours without performing endurance exercises for our wrist and hand. And so back to the vertical mouse. When we use it, the use of the wrist flexors and extensors will be reduced. But some of that stress is distributed towards the handshake muscles or our radial and ulnar deviators. And this is a pattern we've seen many times, and swapping between the mice can be helpful, but again, does nothing to address the underlying problem of poor endurance and schedule management, meaning how often you're adding weights to the stress side of the scale, whether it be through taking breaks or better management of your physical stress. And this is why more than 99% of our patients have reported it being beneficial in some cases, but in most, it did nothing to help them with long-term relief of the pain. And in some cases, with the increased use of the thumb side of the wrist, there's actually more overall pain or discomfort, or it adds a new pain pattern. This doesn't mean that an ergonomic or vertical mouse is useless. It can actually be used temporarily to reduce stress on the involved muscles and tendons. And generally with better posture and ergonomics, our muscles are placed at better lengths and positions to contract. And that leads to the reduction of stress per type or click as discussed, due to the length-tension relationship of muscles. To reiterate what is important, we have to realize that improving your environment through ergonomics does not actually change muscles' overall endurance or even flexibility. Endurance or ability to handle repeated stress over an extended period of time provides the best protection against injuries and strain. Imagine you're set to run a marathon. You are in your 30s. You haven't trained or exercised for several years. If you run the marathon tomorrow, there's a high risk that you're going to injure yourself. And so no one does that. We always train to prepare ourselves for a challenging activity to ensure that we prevent injuries. And most of the time, using a computer doesn't seem like a strenuous activity. It isn't. But with the repetitive small movements of typing, clicking a mouse, combined with many years of low levels of physical activity and limited focus on endurance, it can lead to a similar risk of injury. And this is why exercise is so important, and the research has supported this idea for many years. Ergonomic training on its own has been shown to have limited effectiveness in managing symptoms. And in fact, meta-analyses have shown that the combination of ergonomic training and strengthening exercises provides the best overall outcomes for preventing and managing injuries in the workplace. These studies have been repeated across multiple body regions, always supporting the idea that the best outcomes can be achieved when you combine exercises and ergonomic changes. This is exactly what we have seen over the past decade when focusing on treating wrist and hand injuries of desk workers, gamers, and musicians. In the review of our case data, we found that posture and ergonomics typically plays between a 10 to 20% role in a majority of injuries. And while changes were helpful in extending the duration of activity and temporarily reducing discomfort, it was always the exercises targeting the key muscles utilized that led to long-term relief. And this is why Elliot and I, the physical therapists at 1HP, have focused on creating content and resources that are aimed to help more desk workers implement basic wrist and hand programs to stay healthy. And also why we created an app that actually provides you a personalized exercise program that will help you target those key areas of weakness that maybe led to your issue in the first place. And it actually takes where you feel your pain and your specific level of endurance, the left side of the scale, flexibility, and nerve tension to customize the recommendations and the program. And as a bonus, we also included a posture and ergonomics mini course so you can learn how to best set up your desk while also performing the key exercises you need. You can check that out in the description, and also check out this other video right here to learn more about why exercise is so important in treating repetitive strain injuries for the wrist and hand.